If you're over 50, 60, 70, or beyond, there's a number you've probably heard your doctor mention many times. It's your blood pressure. But here's the thing. Many seniors I talk to aren't quite sure what those numbers really mean, which ones to pay attention to, and when they should actually be concerned. Today, I want to clear up some of the confusion around blood pressure in a simple, straightforward way. We'll talk about what those numbers on the monitor actually tell you, some gentle lifestyle habits that research suggests may help support healthy blood pressure, and the warning signs that mean you should see your doctor right away. I'll go step by step, nice and slow, so you can follow along comfortably. Hello, my friend, and welcome back. I'm Dr. Sarah Truman. Before we dive in, I want to be very clear about something important. I'm a health coach and wellness educator. I am not a medical doctor, and this video is not medical advice. Everything I share today is for general educational purposes only. Please talk to your own doctor or healthcare provider before making any changes to your diet, starting any new exercise routine, or trying any supplement. This is especially important if you have any existing health conditions or if you take medications. Your doctor knows your personal health history and your individual situation far better than I ever could. Nothing I say in this video replaces their professional guidance. Please keep that in mind as we go through today's topic together. Now, why am I talking about blood pressure today? Well, it's one of those health topics that affects so many of us as we get older, but it often gets overlooked or misunderstood. Many people don't even know their blood pressure is elevated until they happen to get it checked at a routine appointment. And for seniors especially, understanding what healthy blood pressure looks like and what lifestyle factors might influence it can be really empowering. So today we're going to cover several things. First, I'll explain what blood pressure actually is and what those two numbers mean in simple terms. Then we'll look at 4 lifestyle habits that research suggests may help support healthy blood pressure levels. After that, I'll address some common myths and mistakes I see people make. And finally, we'll go over the warning signs that tell you it's time to see your doctor right away. Does that sound good? Let's get started. So let's talk about what's actually happening in your body when we measure blood pressure. Think of your blood vessels like a garden hose. When you turn on the water, there's pressure inside that hose that pushes the water through. Your blood vessels work in a similar way. Your heart pumps blood, and that blood travels through your arteries, the blood vessels that carry blood away from your heart to the rest of your body. The pressure of that blood pushing against the walls of your arteries is what we call blood pressure. Now, when you get your blood pressure checked, you see 2 numbers. The top number, called systolic pressure, measures the pressure in your arteries when your heart beats and pushes blood out. The bottom number, called diastolic pressure, measures the pressure in your arteries when your heart is resting between beats. So if your reading is 120/80, that means 120 millimeters of mercury when your heart beats and 80 millimeters of mercury when it rests. For most adults, a reading around 120/80 is generally considered normal, but these targets can vary based on your age, your health conditions, and what your doctor recommends specifically for you. As we age, our blood vessels naturally become a little stiffer and less flexible. It's just a normal part of getting older. This means the heart sometimes has to work a bit harder to push blood through, which can lead to higher pressure over time. This is very common, and you're definitely not alone if your numbers have crept up a bit as the years have passed. The good news is that lifestyle habits can often make a noticeable difference. Research suggests that the choices we make every day, things like what we eat, how we move, how we manage stress, and how well we sleep, may all play a role in supporting healthy blood pressure. So let's go through some of these habits one by one. The first lifestyle habit I want to talk about is being mindful of sodium and focusing on potassium-rich foods. You've probably heard that salt and blood pressure are connected, and there's truth to that. Sodium, which is the main component of table salt, can cause your body to hold on to extra water. When there's more fluid in your blood vessels, it can increase the pressure inside them. It's like adding more water to that garden hose. The more you add, the more pressure builds up inside. Now, I'm not saying you need to eat completely bland food. That's not realistic, and food should be enjoyable. But being aware of where sodium hides in your diet can be helpful. Processed foods, canned soups, deli meats, frozen meals, and restaurant dishes often contain much more sodium than we realize. Even bread and condiments can add up. A simple step you might try is reading nutrition labels when you shop. Look for lower sodium options when they're available. Cooking more meals at home can also give you more control over how much salt goes into your food. On the flip side, potassium is a mineral that may help balance out some of sodium's effects. It helps your body get rid of excess sodium and also helps relax the walls of your blood vessels. Some foods that are naturally rich in potassium include bananas, oranges, potatoes, spinach, beans, and yogurt. Now, here's an important safety note. If you have kidney problems or take certain medications, you may need to be careful about how much potassium you consume. Please check with your doctor before making any major changes to your diet. They can tell you what's safe for your specific situation. A small, manageable step might be to add one extra serving of vegetables or fruit to your day and gradually reduce packaged foods over time. You don't have to overhaul everything at once. Small changes made consistently can add up. Now let's move on to the second habit, which is regular gentle movement. I know exercise might sound intimidating, especially if you're dealing with joint pain, balance concerns, or low energy. But here's the encouraging part. You don't need to run marathons or lift heavy weights. Gentle, consistent movement is what research suggests may be most helpful for supporting cardiovascular health. When you move your body regularly, your heart becomes more efficient at pumping blood. Over time, this can help reduce the pressure on your artery walls. Activities like walking, gentle stretching, swimming, water aerobics, or even chair-based exercises can all count. The key is consistency, not intensity. Let me give you a simple approach. If you're able to walk, try starting with just 5 or 10 minutes a day. Walk at a comfortable pace, somewhere you feel safe, like around your neighborhood, in a mall, or even back and forth in your living room. As it starts to feel easier, you can gradually add a few more minutes. Some people find that 2 or 3 short walks throughout the day work better for them than one long walk. That's perfectly fine. Do what works for your body. If walking is difficult for you, chair exercises can be wonderful. You can do seated marches, arm raises, ankle circles, and gentle twists while sitting in a sturdy chair. There are many videos designed specifically for seated exercise, and I encourage you to explore those options. Safety is important here. If you have heart problems, severe arthritis, or other conditions that affect your mobility, please talk to your doctor or a physical therapist before starting any new exercise. Use a chair, wall, or cane for support if you need it. And if any movement causes pain, dizziness, or shortness of breath, stop immediately. Listen to your body. It knows best. The third habit that may help support healthy blood pressure is managing stress and practicing relaxation. Now, this might surprise you. When we talk about blood pressure, people usually think about diet and exercise first, but stress can have a real physical effect on your body. When you feel stressed, anxious, or overwhelmed, your body releases hormones like cortisol and adrenaline. These hormones temporarily raise your heart rate and tighten your blood vessels, which increases blood pressure. This is your body's natural response to perceived danger, often called the fight or flight response. It's helpful in true emergencies, but when stress becomes chronic, when it's happening day after day, it can keep your blood pressure elevated more than it should be. Finding ways to calm your nervous system may help. And the good news is that relaxation doesn't have to be complicated. One simple technique is slow, deep breathing. Here's how you might try it. Sit comfortably in a chair with your feet flat on the floor. Place one hand on your belly. Breathe in slowly through your nose for about 4 seconds, letting your belly rise as your lungs fill with air. Then breathe out slowly through your mouth for about 6 seconds, letting your belly fall. Repeat this for just 2 to 3 minutes. Some people find it helpful to do this in the morning, before bed, or whenever they notice tension building up. Other relaxation practices that some seniors enjoy include listening to calming music, gentle stretching, or yoga designed for older adults, spending time in nature or looking at peaceful scenery. talking to a friend or loved one, or engaging in hobbies like gardening, knitting, or puzzles. There's no one right way to relax. What matters is finding something that helps you feel calm and making a little time for it regularly. If you experience significant anxiety or depression, please know that those are real health conditions and you deserve support. Talking to your doctor or a mental health professional can make a big difference. Now let's talk about the fourth habit, which is getting quality sleep. Sleep is often underestimated when it comes to heart health, but research suggests that people who consistently get poor sleep may have a higher risk of elevated blood pressure. When you sleep, your body goes into a state of repair and restoration. Your heart rate slows down and your blood pressure naturally dips. This gives your cardiovascular system a chance to rest. If you're not sleeping well or not sleeping enough, your body misses out on that recovery time. Many seniors experience changes in sleep patterns. You might find yourself waking up more often during the night, having trouble falling asleep, or waking up earlier than you'd like. This is common and you're not alone. While we can't control everything about our sleep, there are some habits that may help improve sleep quality. First, try to keep a consistent sleep schedule. Going to bed and waking up at roughly the same time every day helps regulate your body's internal clock. This includes weekends if possible. Second, create a relaxing bedtime routine. In the hour before bed, avoid stimulating activities like watching intense television programs, scrolling through upsetting news, or having difficult conversations. Instead, try reading something calming, listening to gentle music, or practicing that slow breathing technique we talked about earlier. Third, be mindful of caffeine and fluids. Caffeine can stay in your system for many hours, so try to avoid coffee, tea, and chocolate late in the day if you're sensitive to it. Also, while staying hydrated is important, drinking too many fluids right before bed may lead to nighttime bathroom trips that interrupt your sleep. Fourth, make your bedroom comfortable for sleep. A cool, dark, quiet room tends to work best for most people. If noise is an issue, a fan or white noise machine might help. If you snore loudly, gasp for air during sleep, or feel exhausted during the day despite spending enough time in bed, please mention this to your doctor. There's a condition called sleep apnea that affects many older adults and can significantly impact blood pressure. It's very treatable once it's identified. Now, I want to take a few minutes to address some common myths and mistakes I see around blood pressure. This first one is really important. Some people believe that if they feel fine, their blood pressure must be fine too. Unfortunately, that's not always the case. High blood pressure is often called a silent condition because it frequently doesn't cause obvious symptoms until something serious happens. You can feel completely normal and still have elevated blood pressure. This is why regular checkups and blood pressure monitoring are so valuable. Please don't skip your appointments just because you feel okay. Another myth is that blood pressure medication is always unnecessary if you just eat right and exercise. Now, lifestyle habits are incredibly important and they can absolutely make a difference. But for some people, medication is a necessary and helpful tool to keep blood pressure in a safe range. If your doctor has prescribed blood pressure medication, please don't stop taking it without talking to them first. Suddenly stopping certain medications can be dangerous. Your doctor can work with you to adjust your treatment plan over time as needed. I also hear people say that only older people need to worry about blood pressure. While it's true that blood pressure often rises with age, it can affect adults at any stage of life. And for those of us over 50, paying attention to it becomes even more important because the risks associated with elevated blood pressure tend to increase as we get older. Finally, some people think that if their blood pressure is high once, they automatically have a serious problem. One high reading doesn't necessarily mean you have chronic high blood pressure. Blood pressure can fluctuate throughout the day based on stress, caffeine, physical activity, and many other factors. That's why doctors usually want to see a pattern of elevated readings over time, or will have you monitor your blood pressure at home before making any decisions. If you get a high reading at home, don't panic, but do share it with your healthcare provider so they can help you understand what it means. Before we wrap up, I want to talk about when to see a doctor. While lifestyle habits may support healthy blood pressure for many people, there are certain warning signs that require immediate medical attention. Please seek emergency medical help right away if you experience chest pain or tightness, sudden severe headache unlike any you've had before, sudden difficulty speaking or understanding speech, sudden weakness or numbness, especially on one side of your body, sudden vision changes, sudden severe shortness of breath, or confusion or difficulty staying alert. These could be signs of a stroke, heart attack, or other serious emergency. Don't wait to see if they go away. Call emergency services or get to an emergency room right away. Time matters in these situations. In less urgent situations, please make an appointment to see your doctor if your blood pressure readings at home are consistently higher than normal, if you're experiencing frequent headaches, dizziness, or fatigue, if you have any concerns about your current blood pressure medication, or if you want guidance on how to safely adjust your lifestyle habits. Trust your instincts. If something doesn't feel right, it's always better to get it checked out. Let's take a moment to recap what we covered today. First, we talked about understanding what blood pressure numbers mean. The top number is when your heart beats, and the bottom number is when it rests between beats. Second, we discussed being mindful of sodium intake and including potassium-rich foods, which research suggests may help support healthy blood pressure. Third, we explored how regular gentle movement, even just short walks or chair exercises, may benefit your cardiovascular system over time. Fourth, we covered stress management and relaxation techniques like slow, deep breathing, which may help calm your nervous system. And fifth, we talked about the importance of quality sleep and some habits that might improve your rest. Remember, you don't have to do everything at once. Start with one small change that feels manageable for you and build from there. Small steps taken consistently add up to meaningful progress over time. Be patient and kind with yourself. Progress looks different for everyone, and every positive choice you make matters. If you found this video helpful, I would be so grateful if you'd give it a thumbs up. It really helps other seniors find this information, and it means a lot to me. If you're not subscribed to this channel yet, I'd love to have you join our community. I share new videos every week focused on helping you stay strong, healthy, and independent as you age. If you'd like to keep learning, I recommend watching my video on simple morning stretches for seniors next. Gentle movement in the morning can be a wonderful way to start your day and support your overall well-being. I'll put the link on screen and in the description below. Thank you so much for spending this time with me today. It's truly an honor to be part of your wellness journey. Please remember to talk to your doctor before making any changes and take good care of yourself. I'll see you in the next video.